Dry cow therapy, DCT, is a critical management practice in dairy farming aimed at improving udder health during the non-lactating or dry period of a cow, typically lasting 6 to 8 weeks between lactation cycles. During this period, long-acting antimicrobial agents or teat sealants are administered to each quarter of the cow's udder after the final milking of the lactation. This process helps prevent new infections and addresses existing subclinical mastitis, promoting the cow's udder health and preparing it for the next lactation. The dry period is a vulnerable time for dairy cows, as the mammary gland is not actively producing milk and is therefore less resistant to infections. DCT is essential to prevent mastitis, a common and costly condition in dairy farming, by reducing the risk of both new infections caused by environmental pathogens and the flare-up of existing infections. It also facilitates udder recovery, allowing natural tissue repair and improving milk production and quality in the next lactation cycle. DCT can be implemented in two main forms: blanket dry cow therapy, BDCT, and selective dry cow therapy, SDCT. In BDCT, all quarters of all cows are treated with antimicrobials at the end of lactation. This approach is effective in dairy farms with higher mastitis prevalence or limited data for selective treatment. On the other hand, SDCT involves treating only infected or high-risk cows with antimicrobials, while healthy cows receive internal teat sealants. This method is ideal for dairy farms with low mastitis rates and good individual health records, supporting targeted intervention and minimizing unnecessary antibiotic use. DCT offers numerous benefits, including a significant reduction in both clinical and subclinical mastitis. By treating existing infections and preventing new ones, DCT minimizes the risk of mastitis in early lactation, ensuring better udder health. Economically, it reduces veterinary costs and milk loss while improving milk quality, which increases marketability and prevents penalties from milk processors. Additionally, DCT supports antibiotic stewardship, particularly with SDCT, by minimizing the risk of developing antibiotic resistance through prudent use. Healthy udders also enhance cow comfort and welfare, as they reduce pain and discomfort associated with infections. Moreover, cows with healthy udders produce better quality colostrum, directly benefiting calf immunity and health. The long-lasting formulations used in DCT provide extended protection during the entire dry period, requiring a single administration and no daily follow-ups, making it a convenient and effective intervention. The ability to adapt DCT strategies to specific farm conditions further enhances its value. Effective implementation of DCT requires proper administration techniques to avoid introducing infections during treatment. Dairy farmers must adhere to aseptic practices and ensure that treatments are targeted based on individual cow health records. Decisions about culling cows with chronic infections or severe udder damage should also be made carefully to optimize herd health. Monitoring and record keeping are essential to support selective treatment decisions and evaluate outcomes, and integrating DCT with broader herd management practices, such as good hygiene and proper housing, ensures maximum benefits. Despite its benefits, DCT faces challenges, including concerns about antibiotic resistance, particularly with blanket therapy. Encouraging the use of SDCT in well-managed herds helps address these issues. Training and education for dairy farmers on proper administration techniques and selection criteria are critical to achieving optimal results. Additionally, the development of innovative products, such as improved teat sealants and non-antibiotic alternatives, can reduce reliance on antimicrobials and support sustainable dairy farming. Dry cow therapy remains a cornerstone of udder health management, offering substantial benefits in mastitis control, milk production, and animal welfare. When integrated with comprehensive herd health strategies, it ensures better productivity, sustainability, and profitability for dairy farms. While challenges such as antibiotic resistance need to be addressed, effective implementation of DCT can significantly enhance the health and performance of dairy cows, making it an indispensable practice in modern dairy farming.